Welcome to today's workshop, Back to Work, using AI to inform back-to-work plans, build trust, bolster employee wellness and safety amid COVID, sponsored by Jvion. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's workshop with a presentation, and we'll have time at the end of the workshop for a question and answer session. I'll begin by introducing our presenters. Kathleen Moreau, DNP, serves as Chief Nursing Information Officer for the Microsoft Health and Life Science Industry team. In this role, Dr. Moreau advises organizations on how the innovative use of technology can support their digital transformation imperatives of consumer engagement, provider enablement, analytics for population health, and cognitive computing to support a learning health system. John Showalter, MD, is the Chief Product Officer for Jvion and brings visionary thought leadership on the application of advanced information technology to improving outcomes for patients. Dr. Showalter's unique education in biomedical engineering, physiology, clinical informatics, and internal medicine has allowed him to work at the intersection of those fields to positively impact patient care and health system efficiency. And at this time, I'm pleased to turn the floor over to Kathleen to begin today's presentation. Take it away, Kathleen.
Thank you, Brian. I really appreciate the introduction. Microsoft realizes that organizations need to reactivate in a safe manner for patients and employees. We know healthcare starts with the patient. The beginning, the middle, and the end is with your patients and your members by enabling personalized healthcare experiences. When patients are more informed about their healthcare, they have convenient access to their personal medical information. And when patients receive evidence-based guidance and personalized support, they're more engaged with their health. For providers, you're able to respond to inquiries, provide the most up-to-date information, and provide tools for better care transparency and faster service. During COVID-19, there's been a decrease in patients accessing hospitals. They are concerned about exposure, and fear may be keeping them from continuing with management of basic health issues. This is concerning, as well as how will we be able to engage them and bring them back into the health systems. There needs to be a concerted effort to rebuild their trust and reassure them that healthcare is accessible and able to be obtained in a safe manner. We work with partners such as Jvion because we are better together. Jvion can leverage the Microsoft assets to make solutions that are of great value. Their solution will assist in rebuilding this trust while being empathetic to employees and patients. We know that healthcare data is very personal and requires strict privacy standards, and we have an impeccable security reputation. An enterprise-grade cloud at scale allows the ability to create a lifelong health journey across systems, channels, and the ecosystem. With interoperability, we have proven bidirectional connections and normalization to create a unified record. We also have offerings such as Fast Track and customer success guidance for cloud migration and hybrid operations. Jvion can use their ML machine to build the data and analytics that assist with decision-making and answers to questions related to re-engaging with employees and preparing for patients. The bigger picture of getting healthcare back on track includes keeping the public safe and promoting economic recovery. If we are going to reopen, patients and employees need to feel comfortable, and we will want to ensure they are not COVID positive. Clearly, there is a benefit to using artificial intelligence to augment these decisions. According to a survey done by Premier, hospitals will need to expand their COVID-19 testing capacity by more than 200% to resume full services, even partially. Hospitals say they are constrained by lack of testing, reagents, and swabs. Most hospitals hope to screen employees for coronavirus symptoms before resuming non-emergency procedures, but just 32% say they have enough COVID-19 tests for frontline workers. So most will limit testing to those employees who exhibit symptoms. The advisory board recommends 5 best practices for communicating with staff. They include fielding and responding to rumors, giving staff a consistent source of COVID-19 truth, minimizing non-essential emails, making yourself virtually accessible to your employees, and sharing your gratitude personally and often. Microsoft realizes that organizations want to reactivate in a safe manner for employees and patients. Employees want to feel safe and valued by their organizations. The bigger picture of getting healthcare back on track includes keeping the public safe and promoting economic recovery. This will include a downward trajectory of positive tests or documented case of coronavirus over 2 weeks, robust contact tracing, and sentinel surveillance. testing of asymptomatic people in vulnerable populations, such as nursing homes. Jvion is one of our premier AI partners and has been at the heart of healthcare, enabling health systems to excel. To further discussion on re-engaging with employees and preparing for patients, I would now like to hand it over to Dr. John Showalter from Jvion.
Hi, thank you very much, Dr. Moreau. Jvion has been doing clinical AI for almost a decade and was well positioned to respond to the COVID-19 pandemic. Now we have an award-winning background, but most importantly, we have experience with over 300 hospitals and over 30 million patients have gone through the. So in order to use AI for a pandemic and understand truly how communities are going to be affected, we first need to understand how to analyze that pandemic. And COVID-19 is very similar to H1N1, to other respiratory illnesses like the flu that drive pandemics, and the fact that it starts with community exposure and then moves to initial symptoms. Those that have severe enough initial symptoms present to the emergency department. Those that are doing poorly are hospitalized, move to respiratory complications, followed by additional end organ damage, and then unfortunately death. And H1N1 and COVID-19 follow this same pattern. So with a couple of assumptions, assuming a high rate of exposure as we've seen and anticipated, that we would have difficulty getting all of the testing done that we need to get done, and a focus really on outcomes and understanding who's going to do poorly. We were able to build AI insights against COVID-19, even though we didn't have true COVID-19 cases. We were able to use flu surrogates and time sequence surrogates in order to understand which patients were most likely to go on to end organ damage and death. With that, we were able to answer one of the big issues that happened with H1N1, which is an understanding of the risk and disparities within communities. After H1N1 was done, studies were done that determined that those in the most socially economically challenged had mortality rates of 2 to 3 times higher. The CDC put out a call at that time to understand what's the disparities in exposure, what's the disparities in susceptibility, what's the disparity in treatment, and what does that do with regard to disparity in outcomes. In response to that, Jvion created a COVID-19 community vulnerability map that's publicly available to understand risk at the block group level. That has validated out, when we've looked at, the mortality reports and the case reports from various states, we have seen that our relative risk stratification is accurate, and we are identifying those communities that have the highest risk. So with that knowledge, we were able to move forward into answering a number of these back to work safety concerns. So as Kathleen said, trust is really paramount with getting employees back to work and getting patients back to health systems. Over 9,000 healthcare workers have been infected. Lots of patients, almost a third of patients have said they've delayed care. Corporate reputations are at risk if they bring people back to work poorly or are not responding to the crisis well. And of course, there are liability concerns out there with regard to keeping employees safe and making sure you're doing everything you can to protect them. There have been suits from unions, there have been suits from family members of individuals that have died. So the liability concern is out there and real. There have absolutely been operational shutdowns and changes in work dynamics by people trying to work from home or successfully working from home. There's been employee turnover and layoffs in almost record numbers. And all of this has done a lot to damage morale and trust, and it needs to be rebuilt. And in order to rebuild the trust, we need to use the best available science we have, the best available technology to really understand how to bring people back to work safely and keep them safe at work. That goal is then layered on top of the fact that states aren't all behaving the same. Some states are reopening, some states are partially reopening, some states are not reopening at all yet. And we need to make good informed decisions at a local level, not a national level, potentially not even at a state level, but understanding what you need to do for your employees and your community is really important with regard to rebuilding trust and impacting any damaged morale. Critical questions have to be answered to bring people back to work. So once states and metropolitan areas are allowing people to come back to work, you need to know who should see a physician before they come back to work, or an NP or a PA. And whether that visit's done telehealth or in person, we need to have providers weighing in on, several subgroups of patients to make sure that they're returning back to work safely. You need to understand who is vulnerable, who is, at risk of really poor outcomes, either from the communities they live in or the health system, the health problems that they have. And then ultimately who is cleared back to work. And the vast majority of Americans, per our analysis, are ready to go back to work and are safe to go back to work. And we just need to, help employers sort out, which group each of their employees falls into in order to get them back to work as safely as possible. Jvion tackled these problems by creating a AI assessment to bring people safely back to work. It's really three components. The first is a back to work assessment, which is a 25-question AI assessment that looks at a individual's vulnerability, their exposure to COVID-19, if they were COVID-19 positive, their viral load, and their symptoms. It's a web-hosted or app-accessible AI assessment that allows us to understand whether you're ready to go back to work, whether you should see a provider before you go back to work, or if you're all good to go safely back to work. It's private. Jvion maintains the relationship with the employee. All of the answers to the survey are shared only with Jvion and not with the employer. The employer just gets the red, yellow, green because Jvion is extremely committed to employee privacy, just like we're committed to patient privacy in our core clinical AI tools. Once a individual gets back to work, whether that's, they can go right back to work or they end up seeing a provider first, there's an ongoing assessment that can be done with resurveying of the employees or through Jvion connecting with an employee-sponsored health plan and the claims from that employee-sponsored health plan, where Jvion can do passive monitoring of the employees and notify an employee if their risk or vulnerability changes. The third component really is an understanding of the community that we refer to as block group intelligence. It's really an understanding of the vulnerability of an individual based upon. So it helps employees address policies based upon where their employees live, as well as understanding if vulnerable employees should not be sent to an area, whether that vulnerable employee is on a work crew, a driver, or some sort of inspector or meter reader. If people need to travel to particular areas, matching their risk with the risk of that area and ensuring that low risk people are going to the higher risk areas and high risk people are not going to high risk areas can really help an employer keep their patients safe. Technical problems. But so from a workflow perspective, we really are looking at, providing a website or an API that can be distributed through an app, and the employer or the municipality can make the app or the website available to employees. The employees can come in and register, have their email addresses verified, complete a 25-question AI assessment. It does have skip logic, so lots of people don't answer all 25 questions. But the employee's responses then go inside the Jvion core, and there's an output to the employee of you're good to go back to work. You should see a provider. Here are the reasons based upon your answers that you should see a provider before returning to work, or you're really not ready to return to work now, with directions to take the survey in 3 to 7 days, in order to re-up the assessment and get back to work as quickly as possible. We have partners that allow direct linkage to telehealth, and inside the web interaction or the app interaction, get a referral to telehealth. For employers, there's also, aggregate analytics, so we're able to let you know how many employees have completed the survey, what the distribution of red, yellow, green is across your employee base, and possibly do some role and department breakdowns if you provide those to us, and get all of your workers back to work as quickly and as safely as possible. And once they're back at work, make sure that we're helping you maintain the safest work environment possible. That those that are contagious are staying home. Those that are vulnerable are matched to the most appropriate role, to make accommodations and have them do a less a role that the Jvion AI assessment for ready to work can be presented in a website as shown on this slide, or via an API in a chatbot or an interactive app. But from a website perspective, it's what you would expect, a registration page with entering your name, your contact information, as well as your gender and date of birth, which are needed for the assessment. Individuals will receive a verification code and then be able to enter the survey. Once they're in the survey, they'll have a few questions about their job, how often they interact with individuals, and then they'll move on to a portion of the survey that's about positive test, have they been exposed to somebody that has known COVID-19, and questions about COVID-19 symptoms like cough, fever, and shortness of breath. They'll then move into a longer section about their medical history, which really helps us understand the vulnerability of the individual and really drives the AI assessment. You've been identified as ready to return to work, and you can provide this letter to your employer, the whole way to, right now, Mr. Smith, you can't return to work. Please retake this assessment in 7 days. The middle ground that goes to the provider, they'll be provided with a letter that says, this person has completed the ready to work survey, and based upon the responses, they're at increased risk, and it's recommended that they see a provider before returning to work. Here are reasons why. In this example, it's because they've had recent treatments for an illness, or possibly something like a recent oncology diagnosis, or recent chemotherapy, or on immune suppression, that are specifically increasing that individual's risk, and notifying the provider that they should look into these problems and help provide guidance for how to safely return to work. And with that, we're ready for any questions.
Well, thank you, Kathleen and John, for all that excellent information there. And we'll start out here. Kathleen, I got a question for you. So how have you seen organizations proactively plan regarding re-engagement of patients and getting employees back to their offices?
Thanks, Brian. So I'm actually working with a lot of organizations. They're mainly reviewing the data, looking at the data geographically to help decide on opening. Most are working on plans for a reopening that include return of their elective surgery schedules, as well as being able to bring employees back to work. Many are making decisions to keep some employees remote as a solution that's more long-term. So maybe someone who wasn't remote prior to COVID, they've decided to keep them to be remote or have some type of alternating schedule, so they can bring them back and social distance them appropriately. When we think about organizations, I think we really need to consider both large organizations as well as the many small businesses that have been impacted. There is such variability here, and we need to take into each of their needs into consideration. So it will be important for organizations to really communicate, reassure their employees as well as their patients and customers that they have safety procedures that have been implemented.
Thanks for sharing some of your experience there. And John, this next question I'm going to throw your way. So how can healthcare ramp back up to assist sort of with promoting economic recovery?
We really do see this as two phases. So the first phase is that we need to get health system employees back to work, whether that's the environmental service staff, the techs, the nurses, the PAs, the NPs, the anesthesiologists, the surgeons, you know, the other physicians back to work and back to doing procedures. We really need to make sure that we're able to get them back, understand after a long leave what symptoms they've had, have they had exposures, what's their exposure been outside of the hospital system, and you know, there may not be testing for them all. So bringing them back with something like an AI assessment that truly understands their individual vulnerability, plus takes into account their individual experience with COVID-19, if there has been any, we think is going to be really crucial to getting people back to working in hospitals safely. The next piece is then ramping up the procedures. And there's been a lot of discussion with our clients about how to help them do this. A number of them are seeing that they are going to do COVID-19 testing before patients come in for procedures and surgery, but there may be a 5 to 7 day lag between the testing and the procedure, and are looking for an assessment that, you know, the night before or right before the procedure to help them feel confident that nothing's changed in the last 5 days. There are a number of one-size-fits-all technologies out there right now, but we're seeing a lot of holes in those, and we are, you know, very confident that with the right consideration of vulnerability and exposure and symptoms, we're able to really sort out which patients can come in safely, as well as which healthcare employees can be safely at work. And the combination of those two really has to happen to ramp up the trust, to ramp back up the health system volume.
Thank you, John. I got a follow-up here for you. So what are some of the solutions and tools that can assist organizations to help them recover?
Sure. So we're definitely, you know, seeing in the market, you know, temperature screenings and, you know, at the door symptoms screeners. There's, you know, been some concern raised about those with regard to privacy, also with regard to accuracy. The concern about people being able to spread COVID-19 while being asymptomatic in the early period, and not necessarily take into account, you know, enough about the exposure and the vulnerability of the individual. We're not seeing a lot of tools out there that really take into account the vulnerability of an individual employee, their exposure, if they were exposed and were infected, what their likely viral load was, as well as their symptom timing and current symptoms, to really sort out the most conservative return to work possible. So we are seeing a whole lot of technology out there that has a whole lot of holes in it, and we aren't seeing a lot of things like Jvion's bringing to the table in order to really bring people back safely.
A lot of important considerations there. So Kathleen, I'm going to throw the next question your way. So what are the safety first best practices employers can consider with regards to public health?
So I think I mentioned some best practices. Thanks, Brian, for asking. And I think it really includes in giving your staff a consistent source of truth around COVID-19. You want to minimize the non-essential communication, respond to rumors quickly. Leadership needs to really be accessible virtually and being empathetic to the situation and sharing that gratitude with employees. I think many of us are going above and beyond, and we should be acknowledged for this, especially our healthcare workers. I think that having the ability, such as what a Jvion brings to the table, to be able to give the satisfaction to employees that they're being screened, that they're being assessed, and there's an ability to go back to work safely is excessively helpful.
Great. So the next question, I'd love it if you could both weigh in on, and Kathleen, maybe we can stay with you to start. So what's some of the feedback you're hearing from organizations around bringing their employees back to the office?
So everyone that I've spoken to is really taking a very slow and methodical approach. They're looking at the hotspots within their community, and I totally agree with John. It will probably not be like the whole state will open. I think it'll be certain sections or certain areas. For example, I live in Baltimore, and my area actually has a significant number of long-term care facilities that have a lot of COVID positive patients. So the organizations near where I live actually will probably not open up maybe as quickly as some that are farther out from the more urban areas. I think that people want to feel safe at work, so we need to think about how they're feeling, be empathetic to that. This is really a stressful time for them, and we need to be able to approach it in a methodical manner that helps them feel safe, so that they know that when they come to work, they're going to be in a safe environment, as well as our patients. Patients are very concerned about that.
And John, how about you? What are you hearing? What feedback are you hearing about offices reopening?
Yeah, so some of the very interesting feedback that we're receiving right now is how different it is across industries. So when we're talking about our tech industry and our tech industry partners that we're speaking with that have the option to stay home, I heard, I don't know if it's true, but I heard today that Twitter has just announced that they're permanently going remote, and some of the ability to work from home type industries, I think, are going to take this a very, very slow path back to the office. Whereas healthcare, healthcare is delivered in person, in close contact, with close care, and really can't be avoided. Kind of in the middle, then we have, factory workers and distribution centers where, there are ways to put social distancing in place in the workplace, but the employees are still very concerned about coming back to work, but they need to be at a particular location to perform their job and their role, and a lot of interest in understanding what the community impact is to those employees, understanding the environments that they're going home to, and figuring out how to build a trusted employee-employee relationship, whether you are able to work from home, have to work in close contact with individuals or clients, or can work in a pseudo social distanced factory distribution type environment. It all comes down to trust, and what is the employer doing to help ensure that trust.
Thank you, John. And before we sign off here, I want to ask each of you to share some final thoughts. And John, perhaps we can stay with you to start, and then Kathleen, you can weigh in.
Sure. Jvion is, very excited that we are, able to expand our technology to help people safely get back to work. Jvion's mission is preventing harm, and we're really excited that we can take this to primary prevention during a pandemic that has very little treatment, and can help people get back to work safely while minimizing the spread of COVID-19.